Hi everyone, how are you doing? Welcome to the PhysioBrain channel. This is Professor Adriano, and today I'm going to give you some exercise tips to help relieve pain and improve movement for that condition. That is frozen shoulder adhesive capsulitis. So stay with me and don't miss these tips. And as you already know, subscribe to the channel. If you haven't subscribed yet, like the video and share it with anyone you think needs this information. So if you're here because of a shoulder injury that you found out about, that the doctor diagnosed, when you go to physical therapy, you're probably a bit curious to know what it is. Adhesive capsulitis, also known as frozen shoulder, is a condition that happens quite often in the shoulder, okay? So it's a condition that causes the shoulder to lose mobility. It starts to stick, it becomes encapsulated, and this reduces the range of motion, and obviously, when you try to move it, it hurts. So the shoulder becomes more restricted and you have more difficulty moving it. But through physical exercises and well-guided physical therapy, you can regain these movements and have more functionality, more quality of life. Remember that this video in no way replaces the evaluation and intervention, the treatment with your physical therapist, the one you trust and who is treating you. So seek out a physical therapist. But here we give you some tips, right? So that you can get a head start doing some exercises so you can get some relief even before you manage to get an appointment. The first tip is to do a pendulum exercise. The pendulum helps a lot to reduce pain and to start loosening up that capsule to begin to release that area that's almost stuck. There, very adhered. So I'm going to stand up and show you the pendulum movement. So you can do the pendulum movement with a water bottle like I'm doing here, filled, okay? To add a little more weight or any other small weight, anything else that gives it a bit of weight, okay? The idea is that the weight here creates the distraction, right? Reduce the compression in this area. So what are you going to do? First, you're just going to move directly forward and then backward, okay? Moving forward and then forward and then backward in a controlled manner. You can even add a little bit of subtle trunk movement with your entire body. There as well, but not excessively, ensuring a controlled and deliberate motion. The idea is just to create that reduction in compression there. After performing movements that go both forward and backward, you can also transition to moving from side to side. You can effectively utilize a bit of that rocking motion, a subtle yet powerful oscillation, to significantly increase the perceived load, so to speak, through the entire range of the movement, making it more challenging and beneficial. So you move it side to side. And then, to finish this particular action, you can actually make a smooth, continuous circular motion. So you can perform it. I'm demonstrating it here first in a counterclockwise direction, and then you can easily switch and perform it in a clockwise manner as well, completing the full rotation. The idea is to reduce the compression here, to decrease that pain there. That movement which is stiffer is compromised because of this process. There, from the capsulitis, from the frozen shoulder there. Once you've done the pendulum, now we're going to need something extremely sophisticated for you to do this exercise. I'm going to use a rolling pin here. You can use a broomstick, you can use a piece of wood, you can use a PVC pipe, you can use anything that you can hold at both ends. It could be a ball. Even a ball works for this exercise. So the idea is for you to hold it with both hands. So you're going to hold it with both hands, keeping it in front of you. Just like you can see here, I'm holding it. And the idea is to try to move it a little further forward, as far as you can, because this shoulder will be more restricted, right? So let's say my left shoulder is the one that's more difficult, right? My compromised shoulder. So maybe it can't go as far as the other one can. But then I can help with the other hand and go a little further than it's used to, okay? So it goes a little bit, as far as you can, all right? So move it forward and then bring it back. Another one you can do in the same way is to try to lift it a little higher here. So you can try to lift it. This one might not go up as much, but the other hand gives a little help, gives some support there. To lift it a bit higher. And the tendency is that as you keep doing it more often, it will be able to go higher, gaining more range of motion, right? Especially if you've already done the other pendulum exercise, which already helps to loosen up this joint a bit more and gain mobility, okay? So this is the exercise that can also help you gain mobility, forward, backward, up and down, okay? Next, we'll keep using our extremely high-tech object, right? we're going to try to do a movement called external rotation of the shoulder. External rotation of the shoulder is this movement here. It happens in this plane, it can happen here, and it can also happen here. So first, we're going to try to gain range of motion in this segment. So what we're going to try to do is this movement here, but we know that this shoulder here, we're saying that my left shoulder would be compromised. So here we're going to act as if it's the shoulder with reduced range of motion. So let's say it can't go past this range of motion here. So I'm going to use this object here to go a little further. See? It goes a little further. It goes a little further. The idea isn't to lift up here, okay? Not yet. Here, we're just going to open to the side and come back. Open to the side with your elbow tucked against your body, okay? So remember to keep your elbow close to your body and open and close. Open and close. You're gaining range of motion, see, without lifting your elbow away from your body. And that's bringing benefits to your shoulder, okay? It looks like we're just moving the elbow, but we're actually doing external shoulder rotation, okay? So this will really help you gain range of motion. And the next one, which is also the last in this case, we're going to keep using the roller here. And now we're going to lift the shoulder up. So remember that it would be really hard to do this shoulder abduction movement. So open your shoulder out to the side. So you're going to hold here and help a little as far as you can, then come back. Help. Help as far as you can go, then come back. Help as far as you can go, gradually increasing your range of motion and then return. Of course, I exaggerated here to show that little by little you can increase your range of motion until you reach the range you want. All these exercises, the external rotation, the opening, the lifting, the pushing forward, the lifting up, can all be done there. 3, 4, 5 times. You do 5 repetitions, 6 repetitions until you can do 10. Were you able to do 10? Do 2 sets of 10, 3 sets of 10, repeat all these exercises. If you can do it twice a day, even better. Remember not to push past your pain. If you feel a lot of pain, stop, okay? And always look for a physical therapist to do specific training, right? The specific treatment for you. But these exercises will already help you gain mobility, right? Range of motion, reduce pain, and consequently muscle strength as well, so you can have more functionality in that arm, which is encapsulated and hard to move, right? So that's basically it, folks. I hope you enjoyed the video. Give the video a like, okay? Like the video, subscribe to the channel if you haven't subscribed yet. There's also a link to Instagram. Follow us there too. We have a lot of great content as well. So that's it, a hug, and I'll see you in the next videos.